Hey everybody. Y'all know what tonight is. It's Thursday, 7 p.m. Eastern Standard Time. And that means it's time for Conversations with the Shondas. Let me invite a few people. Come on in here, y'all. Say hi. So I know you're in here. I see some familiar tags coming in. Come on in. Make sure you like, tag, and share the broadcast. On Tuesday, we had some issues with our broadcast. We don't know if it was really because of the content or what, but definitely make sure you share. Hey, Miss Terry. Yours was the one that I saw, the first one that I saw. Thank you so much. Tag some folks in the comments. Drop some pink hearts in the comments, because this is our final broadcast of October 2022. October is Breast Cancer Awareness. Hey, Miss Celestine. Thank you for joining us. Come on in. I see people are starting to join. Thank y'all for coming in. Thank y'all for always being so faithful and coming into us. Come listening to us, whatever the topic may be. We're not going to keep you on long tonight. So come on in. Hey, cuz. Hey, Mika. How y'all doing? Yes, I love that hashtag, Miss Celestine. Continue to drop that. Yeah, tag some people. Make sure y'all constantly like and share and tag people throughout the broadcast. That's on Tuesday nights at 7 p.m., Thursday nights at 7 p.m. Eastern Standard Time. Let's get all of our day ones in. Come on in. I'm waiting for my partner, Rashonda Mack, to come on and join the broadcast. As I was saying, we're not going to keep you guys long. We're going to give you some information. That tonight's conversation is about breast cancer awareness. We did a little impromptu session on October 1st, which was a Saturday, in the afternoon, to start off October, which is Breast Cancer Awareness Month. And we wanted to end our last broadcast of October with talking about the same information. But definitely y'all come on in, join us. You never know where the conversation may go. We always have all of the intent to start off a conversation on one route, and we'll end up in a million different ways. So you never know with Conversations with the Shondas how it's going to end, how we're going to wrap it up. We didn't really get a chance to wrap it up nicely as we do normally on Tuesday because of all of the issues. But reminder, this broadcast, this content is not going to always live on Facebook. So wherever we are, I want you guys to make sure you follow us. My name is the same on Instagram. You know, when you change your name, you change your profile. When you change your profile, you change your profile picture on Facebook. It's if you've connected your Instagram page to Facebook, it'll change there as well. So you guys can follow me on Instagram there as well, LaShonda Stevens. And make sure you are following me on any of my YouTube pages. Y'all know I'm a gardener, I'm a couponer, I'm a businesswoman. So for my business page is L Stevens Financial Services LLC. That's here on Facebook. that is also on Instagram, that is also on YouTube, and I actually have a web page, which is lstevensfinancialservicesllc.com. So you can go out there and look at the content that I have on there as well. If you need any of the services, fill out the form. I will get notified when you fill it out. Or you can just DM me. You guys have direct contact to me here. Also, the same for my gardening pages. Gardening with the Country Girl on Facebook, Instagram, TikTok, Twitter, and YouTube. And then my couponing page is Cash Savings with Shonda, which is also here on Facebook, TikTok, Instagram, Twitter, and YouTube. I'm just waiting for my partner, Rashonda, to come on in. Come on in, you guys. Tonight's Conversations with the Shondas, we're conversing about breast cancer awareness. I'm going to give you some stats. We may have a person or two to join us and give their story. If any of you that are listening right now are breast cancer survivors, make sure that you put a pink heart in the comments, and that way I can see you. And if you want to come on live and tell your story, then let me know. Thank you, Miss Celestine, for being so obedient and continuing to tag people. Anybody else, there's 7 people on. Make sure you guys are tagging people. Thank y'all for joining us. Say hey in the comments. Say something so I know you're out there. I see Miss Celestine tagging, and I see Miss Terry tagging people. But I know some more of you guys share the broadcast. We can always see who shares the broadcast. Thank you so much. Say hey girl, hey in the comments. Put hashtag Conversations with the Shondas, hashtag the Shondas. Make sure you do that. I don't have the stars as of yet, so you can't send me stars. I would just like for you guys to send Rashonda stars at the moment until I figure out my star situation. Feel free if you would like to, send her stars when we are live on hers. Remember, every Tuesday we're live on Rashonda's page, and every Thursday we're live on my page. So when we're live on Tuesdays, make sure you send all the stars. That will account for, anything. Thank you, Miss Terry. Anything that the both of us do. It's allowing us to keep our content in different places and spaces. Again, I can't stress this enough. We're not always going to have this content here on Facebook. We are working to get our content somewhere else, and so we're not ready to announce that information just yet. We're still kind of trying to make a decision and figuring things out, but just know wherever the content is, whether it's on TV, whether it's on live, whether it's on social media platforms, we're going to make it so that anybody can go in and make it available to you. All right, so I'm going to wait a few more minutes. It's 7:15 right now. And then I'm going to go into some of the stats, and then we're going to bring in my partner. And we're going to also possibly bring in some other folk to talk about, their stories. Again, if you are a breast cancer survivor on this live right now, and you would like to tell your story on how you discovered breast cancer, put a pink heart in the comments so that I can know who you are, and we can bring you on. Only if you would like to tell your story. I know, especially if it's not been that long ago, a lot of you feel a little skeptical about coming on live and about even just telling your story. It can be an emotional thing, I'm sure. So don't feel pressure. Again, like I was saying on Tuesday, Anybody that we bring on, our goal and our hope is not to create disruption and all of that in your life necessarily, because some things require disruption. Some things require disruption in order to make it better, but that's not our default goal. Our goal is to just make you think about some things. And so one of the reasons that we wanted to have another live about this conversation on breast cancer awareness is to make sure that people are aware of what's going on, not only in our community but also in this country and globally. Breast cancer is definitely one of those things that we all should be aware of, men and women. By far it affects women more, but it's definitely an offender of men as well. So definitely. Okay, and I think I see my partner Rashonda. Let me see if I can add you. Make sure you're liking and tagging. Make sure you're liking and tagging people. Share the broadcast to your lives. Share the broadcast to yourselves. I just added you, Rashonda. It says it's adding you. It says it's adding you, Rashonda. There you go. There you go. Hey, girl. Hey.
Hello.
How you doing?
Girl, I feel so discombobulated. I damaged my phone in the department store just now.
Uh-uh. Dropped it.
Yep.
Listen, I hate that. Mine still got a crack from when I was going to Atlanta in July, and I ain't replaced it yet. But
Mine got big lines going through the screen, so it's brutal.
yeah. But otherwise, how you doing? How was your day?
My day was pretty good. It was pretty busy. Since I'm going to be out of the office tomorrow, it's been kind of
Yeah, you got to get stuff
steady.
done.
Yeah.
Yeah.
I'll probably be logging back on after this live, actually.
So do a little bit more work.
Yeah.
Don't you hate it when you have days off and then you come back and your email is blown up?
Yeah.
Your work is just, especially if you have the kind of job where everything is parsed out, like you're responsible for this, somebody else is responsible for that. So when you're out a couple
Right.
of days, your work just piles up and it almost feels like you can never get back caught up.
Exactly.
It's like
You know my pain.
yeah, and it's almost like you have to put in extra time just to even get back where you were before you left. It's almost designed to have us like not take any days off for fear that we're gonna let this work
Stay
pile up.
behind.
Yeah,
Right.
yeah. But I'm gonna tell you, and see, this is another conversation that we're gonna have on another. That's why we all got to get free from these places. That's why we all got to get free so that we have freedom of time, energy, and financial freedom as well. So that's why,
Absolutely.
yeah. So that's why both you and I are business owners right now. We do our business on a part-time basis, but that's just for right now.
Absolutely. Absolutely. Totally agree.
Yeah. So good. So yeah, I was telling the audience that we're not going to stay on long. It's 7:20. We are wanting to round out October with this breast cancer awareness conversation. We started the conversation. We started the conversation on October 1st, which was a Saturday. It's one of our impromptu uh, lives that we did on a Saturday, and we were kind of talking about it then. And so we knew that there's lots of things going on. One of the reasons that you're off tomorrow is because you're getting ready to do some things in relation to this topic.
Absolutely.
Yeah, this weekend.
Absolutely.
So let's go ahead and get into it. So thank you guys for joining us. Make sure you continue to like the the live. Make sure you're tagging people in, share the broadcast so that people are knowing that we are here. So this is Conversations with LaShonda. My name is LaShonda.
And I'm Rashonda.
Yay! And so we're talking about breast cancer awareness. So let's tell everybody, Rashonda, there's, I love, I don't love that you have to go through this, but I think your origin story is something that I didn't know anything about. Let's get into whatever you want to get into as far as, discovering that you had cancer, and that whole process. And then we'll kind of end it with what you're doing this weekend.
Okay, perfect. So as of November 1st, I will be a 10-year stage 3 breast cancer survivor. I am very elated by that.
Hold on. Moment. Attention must be paid. Attention must be paid. I want everybody who is listening to this live, even if you are listening to it back, you're listening to the recording, drop some pink hearts in the comment section, because 10 years breast cancer free, you are a 10-year breast cancer survivor. Attention must be paid. November 1st, which is actually the next date of our Conversations with the Shondas. But
Oh, really?
It is. But I want us to pay attention to it now while we're in this month of October, which is breast cancer awareness. So everybody, woo, 10 years, 10 years. Okay, go ahead.
I'm just letting that marinate for a minute.
Yes. Marinate. Drop some pink hearts in the comments, y'all. Come on.
Wow. Yeah, it's been 10 years. So I got diagnosed with breast cancer November the 1st of 2012. Stage 3 in situ carcinoma, right breast. I had a right breast mastectomy, and I waited 5 years to get a reconstruction. A lot of that had everything to do with the fact that I was uneducated about the types of procedures that I could have. I wanted to get something that would be natural. I didn't want any foreign objects in my body, and I know that some women that get their reconstruction get silicone breasts and things of that nature, and I didn't want that. I did have a family member, a relative, to get breast cancer, got the silicone, got the reconstruction, ended up with breast cancer in the reconstructed breast and died. So I was afraid of that. And because I didn't know what the outcome would be, and looking back at it in hindsight, I'm glad that I made the decision that I made, because this is something new that has not been added to my story until this year, because I didn't have any prior knowledge until 2021. But I do carry the BRCA gene, the BRCA1 gene, that is the mutation that makes me at risk for pancreatic, ovarian, and breast cancer. Finding out about the BRCA1 gene in hindsight made me a little nervous, with the fear of, getting cancer again. But I was reassured by God that it was just basically an indication that I would have ended up with breast cancer because of the gene. I've already taken care of the breast cancer. I've already went through the chemotherapy. I've already went through the radiation. Again, it was stage 3. I think in one of my videos, I accidentally said stage 4. It is not stage 4, it's stage 3. And I went through chemotherapy. I went through radiation. Radiation, anybody that knows about radiation, it is very intense on the body. You go daily. I believe I went 45 days straight. And now I spend a lot of my time educating those in my niche, in my area, those breast cancer survivors that are new onset survivors, providing a space of comfortability for them, a place of resource and education for them, letting them know some of the symptomatics that may take place as a result of the chemotherapy and the radiation, just based on my experience, based on research and education on what the American Cancer Society has out there on their website. And so now I spend time, and have been for the last 10 years, doing motivational speaking in this genre, to not only women, but to men alike, because men do suffer from breast cancer as well. I have a few survivor males that I am network and partner with that are my Facebook friends and that are survivors as well. They do the same thing. They get out, they educate. And those of you that may have loved ones that have been diagnosed with cancer, or God forbid in the future may be diagnosed, I encourage you to reach out to the American Cancer Society. I am this is my third year serving the American Cancer Society in the capacity of the survivor chairperson. I previously served in Clay County. I'm currently serving here in Orlando area. The walk for this area is going to be on October the 29th, this Saturday. So we're geared up, amped up, and getting committed to those duties. We have a lot of hands on deck to assist with this. We're expecting anywhere from 8,000 to 9,000 participants.
Wow. Wow. So this weekend, if you're in the Orlando area, there's a walk happening. So that's October.
Lake Eola. Lake Eola is the name of the park where the walk is taking place. There'll be a lot of vendors there. There'll be a lot of sponsors there. One of the sponsors that I am currently aware of will be Starbucks. Starbucks is coming out providing free pastries and coffee to all the participants. I believe the walk starts at 8 a.m. I'm not too sure. They will be providing those pastries and coffee until they run out.
Okay. All right. Starbucks. We like any company that supports breast cancer survivors. So if you guys are in the Orlando area, it's October 29th. You said at Lake Eola Park. And what time does the walk start?
I want to say 8 o'clock. Where's my calendar?
Okay, so everybody's will be lining up at 8.
Let me double check that time.
Okay.
8 is not a bad time to come, because there are groups that are organized that have been fundraising to our pace setters have been fundraising. One group that I'm aware of will be reporting almost $5,000. Collectively, we've been raising a lot of money, giving back to the survivors. Just talking about the American Cancer Society in itself, I don't think a lot of people are aware of all of the resources that they provide. They have gas cards for survivors that they can provide while you're going back and forth for your treatments. They have Road to Recovery, where other survivors like myself volunteer to get other survivors to and from their treatment and doctor's appointments.
Yeah.
They also have Reach to Recovery, which is basically a group therapy session for those that have been diagnosed, looking for that comfort and support from those that understand the condition. There's also a Hope Lodge that is up and running. I believe the Hope Lodge has been up and running now a little over 2 years. The Hope Lodge started when I was chairperson of Clay County. I want to say back in 2019. They are a lodging facility free of charge to the survivors, where you're able to stay and have lodging during treatment. They do have Hope Lodges in other areas. I'm not too sure offhand where those other areas are, but here in the Florida area, there is one in Jacksonville. They also provide clinician support via a hotline They have 24/7 support. The Reach to Recovery is the same way for that support. There's an online um, Reach to Recovery app that you can also join the group support system as well. They also are affiliated with affiliated hotels. One of the hotels that the American Cancer Society is affiliated with is the Extended Stay America. And just a little quick story concerning that. When I got my reconstruction, I had to go to Manhattan, New York. I stayed there for a total of 14 days. I do have relatives there. I stayed with relatives for about 3 or 4 days, but 9 days I stayed in the extended stay hotel with the help of the American Cancer Society. And all I had to do was pay $32 for the taxes for those 9 days. So
Wow.
they do have a lot of help that they provide the survivors.
Wow. Wow. And I love you talking about all of the different ways in which, the American Cancer Society and other places, the Hope Lodge and all of that are able to help survivors. There's so many resources out there because there's such a need for people. When you're going through chemo, when you're having to, go through that reconstruction, that can be a private affair, and that could also be isolating for people who don't necessarily want to show people their bodies parts and things like that. So to have people and resources out there that know that people are struggling with that part of it, whether it be a cosmetic side or whatever, but that there's, a need to find normalcy or help people find some sort of normalcy with going through this. So I love that you talked
Absolutely.
about the resources. And y'all, let's get these numbers up. When we talk about relationships and we talk about family dynamics and we talk about different things like that, we'll have like 10, 20 people on the live. When we're talking about important things like your health and things like this, I want us to have just as many people on the live tuning in, okay? Because this is important.
Absolutely. I'm
This,
glad you said that, Shonda, because the lack of our health education, health literacy is definitely a area that we need to pull up in as a people. And we need to have the conversations about the lack of access to care. So having these resources available at hand through organizations like ACS, the American Cancer Society, is vital to one's continuity of care.
yeah, yeah. And while you're talking about that, I was on Google and I was just finding so much information. There's like a plethora of information out there about breast cancer. And I'm gonna get back to you in just a moment for you to tell us your origin story with this disease, how you discovered it and things like that. But I want to just give some stats about breast cancer and how, it affects the community. Um, Let me see, where was I? Ooh, I think this was the cancer.org. So this is ACS right here. Facts and figures for 2022. Let's see. Hold on, I got to clear off the pop-ups that come up. So there's an estimated number of new cancer cases and deaths in 2022. In 2022, there will be an estimated 1.9 million new cancer cases diagnosed and 609,360 cancer deaths in the United States. Current cancer incidence, mortality, and survival statistics, information on cancer symptoms, risk factors, and early detection and treatment can be found on the American Cancer Society. So if you hear Rashonda say ACS, she's talking about American Cancer Society. You can Google that. It's cancer.org, and getting information about that. So in here it was talking about the stats and there's I don't want to scare people with talking about the stats, but the stats are what we really should be talking about. It's not for fear mongering. I just want people to know, that this thing does affect our community in a lot of ways. Um, Let me see here. It says among women age over 50 years, breast cancer incidence increased 0.7% per year during 2010 and 2018 among those aged 20 to 39 years, and zero, hold on. Yeah, it increased 0.7%. And then for 20 to 29, 0.4%. And then during 2002 and 2018, among those aged 40 to 49%. That doesn't read right. So, in case you didn't know, in order to get a mammogram, you have to be between the age of, you have to be over the age of 40, right? And so and the reason for that is because of this stat that I just read, is that there's more, there's an increased number of cases of breast cancer in people in this age range, 40 to 49. So that's why, it's said that you need to have a mammogram to detect, for early detection at age 40, unless you have a personal history of cancer or breast cancer in your family, right? So if your mom, what do they say, your mom, anybody close to you that's had breast cancer, you're probably higher, you have a higher chance of getting breast cancer, right? Is it moms, grandmoms, people like that? Like they don't really count cousins and aunties?
No, it's really just your immediate, and extended immediate family.
Okay.
Just like me, because I was diagnosed, my daughter will have to have a mammogram by 20.
Okay. Okay. So that's good. So if you're approaching 40, let me see, Jacqueline says, someone just told me you have to be 45. What is the correct age to have a mammogram? It's 40, age 40. It's age 40. And what you want to do more than anything for you guys who have healthcare, and I don't know how Rashonda dropped. Let me add her again. Okay, so while she's coming on, it's age 40, but the best thing to do is to check with your insurance companies to see at what age they're going to pay for it. If you are someone who has health insurance, check with them, because usually you get one mammogram that your insurance company will cover at 100% to you, and then you can get a diagnostic mammogram as well, and those may be subject to your deductible, copays, co-insurance, and your out-of-pocket maximum. Yeah, if anybody asks you about it, the age is 40, not 45, 40. 40. You should be getting one a year, and that's one every 365 days. If you are Medicare eligible, you need to stick to that 365-day time frame. So if you have it in 2022, January 10th, you have to wait until January 10th or after in 2023 to have your mammogram again. If you get it anytime within that 365-day window of having your one for the current year, Medicare will not pay for it. And this is the case with a lot of insurance companies. Medicare, though, will not pay for it. Your other insurance, the commercial payers and any other payers, what they will do is apply it towards your deductible and your out-of-pocket maximum, if your deductible is applicable to your out-of-pocket maximum. So for sure, make sure if before you do anything, don't wait for somebody to tell you, oh, you got to wait to 45. Check with your insurance company and see what age they will cover it and how they will cover it. And also, I'm trying to think of the other name.
There is a breast cancer Medicaid that you can get. Now, I'm not sure, Medicare traditionally is for 65 and over unless you have a disability. But there is a breast cancer Medicaid that recipients will be eligible for upon a positive diagnosis of breast cancer.
So check your area, because we have that here in North Carolina. It's the PINK program. It depends on your county. Each county in North Carolina calls it a different thing. So check with your county people. I know I can call 211 or 411 here in Charlotte, and they'll give me that information, those resources to that information. But it's check with your state, check with your county, check in your area, because like Rashonda said, there are so many resources out there, including breast cancer Medicaid. So if you are someone who is without health care, um, make sure you're reaching out, even if you're reaching out to one of us, so that we can point you in the right direction um, for people who need access to resources, all of those different things that Rashonda just named, about if you have a positive diagnosis, helping, transportation to chemotherapy appointments, and even lodging, um, care and help with reconstruction and all of that process. Um, but I wanna take some time before we get more into the statistics, and I just want to hear, Rashonda, how old were you? Where were you? What were you doing when you decided that you were gonna go to the doctor because you felt like something was wrong, something was off, you needed to figure out what was going on? Like, where was you at? What was happening?
So at that time, I was 33, and my kids, their ages were 10, 5, and 3 at that time. I was caring for my 85-year-old grandfather, who has since gone to be with the Father. Um, but I discovered this lump in my right breast as I was resting one night. I normally sleep on my abdomen, and I turned over, and for some reason, I hit an area on my breast that felt very uncomfortable. I remember mentioning it to two of my sister-in-laws back then, and both of them, and they weren't even in the same conversation, but both of them had come up with a theory that it could have been hormonal or caffeine related.
Mm.
And I wanted to believe that more than you know. And I presented to the emergency department maybe about 2 weeks after having that conversation with them. And I had a ER physician to do a manual exam on my breast, and he felt the lump.
So hold on. Let's break this down. You were 33, so you were prior to the age at which doctors recommend having a mammogram. Your mother had never had had any diagnosis of cancer or breast cancer, right? So
Correct.
as far as you were concerned, you're out of the risk factors. You're not 40.
Correct.
You
Correct.
your nobody, your grandmother nor your mother had any incidences of breast cancer.
Well, actually they did, but I was too young to know about it with my grandmother. She had had an episode of fibroids that were malignant at one
Oh,
point.
okay.
They, and that was in her reproductive area, but they removed those, and she had had
Relapses.
no other evidence of it.
Okay.
And also my mom had an episode that I can't say I wasn't privy to. I was too young to acknowledge what was happening. But I remember her having a tumor in her head.
Mm.
They removed it, but they kept saying that it was a skin cancer in her scalp,
Mm.
and it
Mm.
was a lump or whatever. She had that removed. I remember them removing skin. They drafted skin from her thigh to place in her head. And she was bald in that spot, but she had long hair, so it wasn't, if you didn't know it was there, you wouldn't know.
Right.
So those were the episodes, but nothing leading towards breast cancer, if you will.
So that's
So
why
yeah,
they say. So that's why they say you have to pay attention to. And you didn't know. You were too young. Let's
right.
remind everybody that your mom passed away when you were 11 or 13.
I was 13 when my mom died.
You 13. So the stories, about your mom or any incident, you were too young to even for it to register,
Right,
with in relation to your mom and your grandmother. But
right,
also, it's not just about a history of breast cancer in your family, it's also a history of cancer, that we
correct.
have to pay attention to. So that's why when you go to the doctor and your doctor's asking you all these questions about history of cancer, make sure you are, being forthright and forthcoming about that information as well, because
Absolutely.
people whose family members have incidences of cancer are also have a higher chance of getting
High risk.
breast cancer. Yeah, they are high risk as well. So it's not just about having somebody else in your family with breast cancer, but also any kind of other cancer. Okay. So make sure you're telling your kids what you're going through, age appropriate information, I'm saying. But, if you have adult children, make sure you disclose that information to them for their own health as well. So continue. So the ER doctor found the lump.
Right. He did. And he also did, I can't remember the imaging I had. I can't remember whether it was the MRI. I had some imaging done at the time in the ER.
Mm-hmm.
I remember on my discharge summary, they had recommended that I follow up with the surgical associate team. And I did. I placed a call to them maybe a few days after the ER visit. And they basically did my intake, traditional, got my insurance information, which I didn't have. So she told me at that time that I would have $150 copay up front. And when I was making that appointment, I knew in my mind, like, yeah, chances are I won't be going to that appointment. Because at the time, my ex-husband was the only one working. I didn't have any health insurance. And here it is, I got a lump in my breast, and I don't even have the resources to go and see about myself.
Right. Right. So
Um,
the appointment that they were telling you about was going to cost you $150. You were uninsured at the time, and you weren't sure that you were going to
Unemployed as well.
uninsured and unemployed. And so you were like, okay, I know I'm not going to make that appointment because I don't have the $150 to pay for that appointment. But go ahead.
So the appointment time came. I did not present to the physician office because I didn't have the money. I didn't even call to say I wasn't going to go because truthfully, I was embarrassed because I knew I didn't have the money. And so a week later, I get a phone call from that same physician office following up to see if I still had a concern for the reason for my appointment. Excuse me. And I remember speaking to the young lady in the office, and she verified that I was who I said I was. And she said that she was calling to, check up on my missed appointment. And I advised her at that time that I didn't keep the appointment because I didn't have the funds. And she told me at that time, she was like, don't let finances stand in the way of you being able to get medical care. She said, I'm going to speak with the office manager. She even advised me that there were resources that were at the hospital, and this was in South Carolina. This is the Regional Medical Center, by the way, Regional Medical Center. They have a charity program that does assist with those people that are not able to pay for their visits. And so she made me an appointment. I went in the very next day. I was seen by a doctor named Dr. Red Cross. He's no longer with that practice. He's in the state of Georgia now, I believe, when I last looked him up. But he did a biopsy. He took a specimen outpatient in his office. I would imagine I had local anesthesia or something to numb me, or maybe I didn't, because I was acting really awkward, and I was, I could see the spatula, they were cutting me, it was just too much going on. So when the results came back from that episode, they advised that the results were inconclusive because they didn't get enough specimen and they weren't able to make a determination on the results. So the doctor decided that he was going to do outpatient services at the hospital, where I would go under anesthesia, and they put me to sleep, and they went deeper. They got more. That result came back that I did have stage 3 in situ carcinoma.
Wow. So I just want to recap. So you're 33 years old, uninsured, unemployed, under the age at which, there's a chance that you might have, or where doctors recommend having mammogram. You do have a history of cancer in your family, but you weren't really aware of all the details about that at the time, but there was no previous history of breast cancer. You feel this lump yourself. 2 weeks later, you're in the ER. The doctor feels the lump, sends you to a specialist. They decide that they're going to, take a biopsy. That came back inconclusive. They sent you to the hospital to have to have a deeper look at
biopsy.
Another biopsy. That came back positive.
Stage 3 in situ carcinoma.
So I don't know, but you tell me. So when they told you what it was, what was your thought process?
Well, if I really be transparent, I was a little cocky with my thought process on it. I had previously worked at the hospital twice, so I have rapport with some of these people in this office. My thoughts were that if I was abnormal or positive, that my physician would have been the one to give me my results. And that was how he wanted it, honestly. But he got caught with an emergency surgery the day of my appointment to get my results. So when I presented to the office, he was still in surgery, which resulted in another physician initiating my results to me, which made me even more comfortable thinking that, I'm pretty sure my doctor would want to give me a positive result. I'm going to be fine. I had another friend with me. Her name is Olympia. I had her with me at the time. And I remember him looking into this chart. And, I am familiar with medical terminology because not only do I hold a degree in medical billing, but I've been a unit secretary in the same hospital that I'm at their, surgery center for twice. So I was very aware when he said carcinoma that it was cancer. I might have not understand the extent of the in situ. I understood clearly stage 3. I knew stage 4 was terminal. So I knew enough. I was educated in it enough to know that I need to have some concern.
Yeah. I love that you called it cocky, but what I think a lot of people miss is that you got to be a fighter in this thing. I too am in the medical field, and a lot of clinicians, a lot of people, a lot of helpers, people who help get people set up with the chemotherapy, they say they can tell the ones that are going to survive and they can tell the ones that may not. And it's all about your mindset. So if you come in, if you come with that mind, like I'm gonna cut this, I'm gonna beat his tail.
I'm impressed by your statement, Shonda, because, and I want to say exactly what I mean, and I don't want you to take this any kind of way. I'm impressed by the fact that you're not a survivor and you realize that it takes a mindset. Because you're probably the first person that I've had a conversation with that doesn't have, well, you do have a loved one that has been diagnosed with breast cancer. I don't know if your thought process comes from that or how you gain that understanding, but it definitely takes a mindset. I was claiming my healing even before I got a PET scan, which is a scan that would determine whether or not you are truly cancer free. So you got to go in this thing with the mindset that I'm already healed through the blood of Jesus, and that no weapon that is formed against me will be able to prosper. And that has been my mindset from the very beginning.
Yeah. My information or my knowledge about it comes from my profession, because I've been doing this. So I work for a company that owns Charlotte Radiology. US Radiology is who I work for. And so that's what we do every day, day in, day out. We do a bunch of mammograms. Charlotte Radiology is known for mammograms, right? We also do high-tech imaging services. So not just mammograms, but CT scans, MRIs, PET scans, in which you were just talking about. And I've also been, I converse with patients who, have these things going on. And I also talk with my staff, the facility, the people who are actually running the machines. I'm in the billing area, I train people. So not only that, but I listen to podcasts and I hear people talk about, their situations, not only with breast cancer, but just cancer in general. And the overwhelming theme of people who survive this disease are people who have the mindset that I'm going to continue to fight and I'm going to continue to do whatever I need to do. Yeah, I might not feel like going to this chemotherapy appointment, but I'm going to go. I might not feel like getting up and, washing my tail, but I'm going to go. I might not feel like doing this or doing that, but I'm going to keep on fighting. You got to put one foot in front of the other. And so that should actually be all of our mindset in any adversity that we go through, is that you need to have a positive mindset about it. But I know for sure with breast cancer and cancer, that is one of the things that people say. And I'm telling you, I talk to facility administrators, people who actually are running the machines, facilitating people getting on these chemotherapy machines, and they can always tell. The ones who are just like, I'm just tired, those people don't necessarily make it, but the ones who keep on fighting, those are the ones who live to fight another day, and I know it's not easy. Because again, I do have, Andrea is a cancer survivor as well. She didn't have breast cancer, but she did have cancer. And then Andrea's mom has breast cancer, or had breast cancer. I got a couple of cousins, some of my mama's first cousins had breast cancer. And so, it's all up and around the atmosphere, so I keep that in mind when I'm, interfacing with staff, people, or customers, because I know what that is. But I'm just so grateful that you are a survivor, and it's 10 years. But let's continue on with, because so you got the information. You weren't like deterred by that. You're like, okay, I'm gonna fight this thing. So
no, absolutely, I was deterred. Absolutely, I was deterred. That would be an understatement to say that I wasn't deterred. I knew that. Okay, let me back it up. So I didn't always have that mindset. I developed it along the way. So I got a 10-year-old, a 5-year-old, a 3-year-old, and I'm caring for an 85-year-old grandfather. So my first mind space was, who's going to care for my kids like me, and that was my biggest thing. Like, I got to live for my kids. Like, there may be stakeholders and there may be people that love them, but nobody's going to pour out like mom,
Right.
I knew that based on the lack of support that my grandfather had when my grandmother died, I knew that I was the only one. So that just made me fight even the more because I got people that's depending on me. Um, so dying wasn't even an option, you know,
So
whatever
for
I,
you, so for you, tell me, so for you, you had to find your why you needed to fight. And so for those
correct.
people out there who are looking for a reason to continue to fight, maybe you're a little bit older than 33, maybe you've got a whole bunch of things going on, but find your why you should fight, whether that be someone else, your kids, or even just for yourself. You want to live. Find your why you should fight.
Absolutely. And while you're finding your why, you know, I had an aha moment about 2 years ago, but we were in the thick of the pandemic. And last year, I was invited to a Survive and Thrive online event to be a guest speaker. And the theme was Survive and Thrive. And something really resonated with me last year after doing that, because I have been giving of myself through the American Cancer Society, pouring out my story, sharing the resources that the American Cancer Society provides, you know, lending my leadership abilities through the chair survivor role. And now being in my third year, I wanted to do more. I think that is why I'm going to birth out a support group, because I have the resources that are there. I know what it takes to survive. I know what the mindset needs to look like to survive. I know what the care giver environment needs to look like for you to survive. But I also have created a dynamic that will take you from survival to thrive mode. So now I'm trying to focus on that. And when you say, what is your why? And I just spoke similar to this a few weeks ago when I was in South Carolina for another speaking event. And now I want to take the survivors, those that are truly ready, those that have recognized that they have gone from a survival standpoint to now I'm ready to thrive. What does thriving look like for you? Thriving could be looking different to one person. Thriving could be, okay, I'm ready to be around other survivors now so that I can get the support that I need. I'm ready to come out of my shell. I don't want to be ashamed about it now. Or even if I am still ashamed, let me be around a group of women that will help cultivate me and give me confidence in what I'm doing. Number two, thriving to someone like me. I've been pouring my story out. I've been sharing my story. I've been getting with support groups. I've been getting in organizations. I've been creating projects to make survivors feel good. Now, I don't want to just talk about breast cancer in October, because survivors every day, 365 days of the year, are being impacted. 365 days of the year, they're needing resources. 365 days of the year, they're needing financials. 365 days of the year, they're needing somebody to cry out to. So I'm wanting to now partner with bigger organizations to help my business be able to collaborate, provide a support group that will cater to the needs of the survivors, help them, those that are ready, because I'm in a speaker mogul group that is cultivating me to share my story and to teach others to be able to share their story. So being able to cultivate and help them, those that are ready, not forcing anyone, but those that are ready, because that's the set of people that I'm looking for, help them get their story out there, provide a platform for them to be able to share their story to other like-minded supporters, caregivers, organizations that may be looking for them. So that's where I'm at now.
Okay, good. So on a day-to-day basis, for someone who's undergoing the treatment process, what does care look like? Because there may be people out here in this, because when I asked the question when I first got on here, if there were any breast cancer survivors in listening in on the live, nobody put a pink heart down there. So I'm gonna assume that everybody here has no direct connection to breast cancer. So that means we could potentially know somebody though, you know, whether we're the caregiver or not, what does someone who may have a breast cancer survivor, how do we need to show support on a day-to-day basis? From the, like, I know there's resources, I know there's, you know, things that you can do as far as sharing your story and whatnot, but on a day-to-day level, what can you do to somebody who's undergoing treatment? What can you do for them? How can you support them?
My answer will be very general because people respond differently to sickness and the recovery of it. So some people may want to be isolated because I did go through a season of that. I think it's important for you to find out what that survivor, where they're at, and don't be overbearing and overpowering right along through this part of assessing their needs. Ask them, you know, do you mind if I do such and such? One good thing could be, you know, right after surgery, they can't get out and do a whole lot. You may offer to get their groceries, or they may order them on Instacart. You may offer to go pick them up. You may go take them to a chemo appointment, a radiology appointment, a physician's appointment. You may take them to go get a wig. They may feel insecure after they've lost all of their hair. You know, you may be able to go take them and do wig fitting. Another resource that I failed to mention is, and you would have to look in your local areas, most oncology centers and oncologists have a list of participating boutiques, etc., that offer bras during your time of treatment and recovery. The bras provide you with support after your mastectomy, and you're able to put your prosthetic in the bra, you know, to have a normal figured look, you know, in your tata area. And so you have, and they provide anywhere from 3 to 5 bras annually. So you don't have to pay for bras really for the rest of your life. Now, I buy my own bras now because I don't have a prosthetic. Now, I can still wear the bras without the prosthetic, but I just chose not to. And honestly, I just recently found out where I could get them here. But you want to be able to link up. You're due for that for the duration of your life once you're diagnosed. So you'll never have to pay for bras again if you don't choose to. Another way of support is finding out how they feel after treatment. One thing that has been a good remedy for treatment is lemon drops. Because you get a sense of nauseation after chemo, and lemon drops and peppermints have been known to be extremely helpful. So you can offer those types of things. You could even get them like a neck pillow because they sit in treatment for a long time. So you want to make them comfortable during treatment. You may want to get them a blanket, you know, because in most treatment centers, it's cold. So having a blanket or a regular size pillow is very helpful during treatment. You might want to get them crossword puzzles, Sudoku, or however you pronounce that, the books, you know, just regular reading material while they, you know, utilize their time while they're having treatment.
Yeah, and Miss Celestine said ginger. She said, and ginger.
Ginger is a great property, absolutely. Yellow dot root is a good property that you can use also. She said ginger candy also, absolutely. Getting crackers, saltine crackers, any type of rich saltine Clubhouse, they were helpful for me. Getting ginger ale, I don't like ginger ale, but that's a good drink that you can use. Sprite is a good drink that you can have.
What I hear you saying, Rashonda, is let them lead. Let them lead on how you can provide support. So don't come on with your takeover spirit and try to just do everything, because some people are private. Most of the people that I know, especially in my family, they are very private about the things that they go through, especially on the side of cancer. A lot of times you won't know about it, you won't hear about it until they already done survived it, So yeah, like when they oh, that was years ago. You won't hear about it. So um let them lead. So if you discover that someone is sick and when they ask you, I'm just, for me, I do have sort of a takeover spirit, but I also am sort of an empathic person. I can tell when people are down. I can tell when people are not themselves. And so for me, I don't generally like to wait until somebody asks me to do something. That's how I am in general. I'm somebody who, if I see a need, I'm gonna act.
And I was going to say that use your discernment there, because some people don't know how to ask for help, but they truly need it. So, and you would, if you know them, you would probably know that about them. So just gauge it, um, because everybody may or may not be subject to your help.
Right, right. They might not.
And
Some
I'm
people
low
just don't want to
vibrational
be
tonight.
looked at.
Don't judge me.
Some people don't want to be looked at as a patient. Some people don't want you to feel
Pity,
sympathy or
right?
pity for them. Yeah, they just want to be left alone. And so I can understand how the isolation can how isolating that can be, especially when you're not around people. And so I love that you keep talking about support groups and things like that. So if you're someone who doesn't want to share it with your immediate family, there's definitely support groups out there that you can join, and so that you can really talk about what you're really going through. So I love that. So we already talked about the age, because once you get diagnosed, there's a whole process, there's resources and everything. But I do want to say, for those who don't have that story right now, um, early detection is the key. And so that's why mammograms are so important. Make sure you get your mammogram every year. And then not only that, make sure that you are palpating your own breast, that you're doing self breast exams. I wanted to stop you, but when you were talking about the caffeine and then the hormonal things, one of the things, when I looked on the website, as far as things, do's and don'ts of when you go get a mammogram, one of the things that they advise you not to do is put on deodorant. They advise you not to put anything on your breast tissue. They advise you not to drink caffeine, so no sodas, no any of those things with caffeine in it. And even they say avoid the time when you're on your cycle, or on your period, actually, because your breasts are a little bit tender then. And so typically when you go get a mammogram, it's not painful. But if you're already someone who has sensitive breasts because you're on your cycle, and then you go try to get a mammogram done, that can put some extra pain there. There might be some extra sensitivity there. So I love that you said you were thinking that initially that it might have just been because of the caffeine intake. It could have been hormonal, that was the advice that you. But I'm glad you pressed on and went and saw someone to make sure, or to just confirm whether it was or not. So early detection is definitely the key. But if you find yourself with a positive diagnosis, like so many women across our community and our country, there are still resources out there. It doesn't stop with a positive diagnosis. Resources are available to you before, during, and after a cancer diagnosis.
And another thing I wanted to mention when you were talking about the mammograms, one of the things that I have been following now for a couple of years, there's a lady, I can't remember her name. She's been researching, and I think she had the laws change in her state pertaining to something about the density of the mammograms, because if your tissue density is too dense, it won't detect a true reading in some cases. And she had the mammogram testing, something happened in the legalities, in the legislation within her state as a result of her fighting for it. I'll probably share that another night when we come back. I should have wrote it down for the sake of this conversation. But just making sure, if you feel like you even need to get a second opinion,
Yeah.
don't hesitate to do that as well.
Yeah.
Also, one other thing I wanted to mention, and I just know this now in hindsight, I used to work for a health department that did family planning services, and they provided birth control. And I found out after moving here to the Orlando area from my oncologist, because I had been just kind of coming up with my own little theories about how I could have possibly got it. And not to mention, I got the BRCA1 gene, and it obviously is hereditary from one of my parents. This was before I knew that. I had already suspected that it could have came from birth control because I was on various birth control methods, basically trying them because I had worked for this health department and had free access to them. So various birth control methods came on the market. Do your own research. I'm just going to put that disclaimer out there. I'm not a clinician, but my oncologist did confirm to me that on certain birth controls, it is listed that it may cause cancer. So I just want women to be very proactive in researching. Read the fine lines when you're taking these birth control medications.
Yeah.
Well, we don't got to worry about that now. Do we? No.
I mean, it depends. I don't, because if I end up pregnant, that's going to be a miracle. But
me too.
But if if I am blessed with the miracle, then he or she is going to be here. He or she is going to be here.
Exactly. So I haven't done any research on this whole abortion thing, and I'm not savvy enough to have that conversation tonight. But in times past, she admitted that birth control may have contributed.
Yeah.
Right.
Yeah.
So I just want to say that too.
And that's the thing about any of these medications, especially in our young people. We don't have enough information, enough history about it to know, what it causes. And now, in my 40s, because I was someone who got on birth control really early, and dealing with certain things that I won't list on this live, but I know that probably that, has a contributing factor. I want to go back and talk about the different types of mammograms because you brought that up. I'm glad I would be remiss to not talk about this. So there are two kinds of mammograms that you get. There is a screening mammogram, which is typically what most of us get when we go to the doctor, when we go get a mammogram. It's a screening mammogram. It's just the one that we're just screening for anything. Then the other one is a diagnostic mammogram. Diagnostic mammograms are for people who have just what you were talking about, dense breast tissue. And what that means is you got a lot going on up there, right? You got a lot going on. That's dense breast tissue. Or if you have a family history of cancer or breast cancer, they will advise you to have a diagnostic mammogram done every year. If you only have the one diagnostic mammogram, typically most insurance companies will treat that as the screening mammogram and will cover it at 100% of the cost, no cost to you, right?
Depending on your health plan.
Right. All of the disclaimers are, it depends on your health plan. You need to be reading your summary plan description to find out what your insurance will cover, how they will cover it. Ask these questions before you get the services done, because that way you're not surprised. And even then and only then, it is up to your insurance company to process it how they may. Now, you might have to hold their feet to the fire with certain things. If it's listed in your plan description that they should cover it and they didn't cover it, then you need to provide medical necessity proof and things like that. But there's typically two mammograms that you can have. A screening mammogram, which is what all of us get at the age of 40, unless you have a history of cancer, breast cancer in your family, you're going to have it beforehand. And the diagnostic mammogram is for those of us who have breast a dense breast tissue or a family history 40 and above, right? Now, in addition to that, there is something called a tomosynthesis. In the medical billing world, we call it a tomo. The tomo is a 3D imaging of your breast tissue. It is one of the best ways to look at your tissue. So I'm saying this word tomosynthesis to you for a reason. The reason is, up until recently, there were some insurance companies that did not cover the tomo portion of it. So while you were going to get your regular mammogram, whether it be a screening mammogram or
Regular
a
diagnosis.
diagnostic mammogram, there was another charge on there called the tomo charge. And that is the 3D rendering of the image. And that is the best way for the radiologist to look at your tissue. Some insurance companies didn't want to pay for it up until recently. And the reason that they didn't, because they didn't know that there's more information. Let me not go into that because, I don't want to.
So I'm curious because I may have had that type of diagnostic. Is this where they can see into your vessels and all of this stuff? Is it very
yeah. It is a better
invasive?
way. Yes, it is a
Okay.
better way, especially for those who have dense breast tissue. I'm going to tell you this though. Typically, when you get a mammogram, there's a pair of charges that are billed to your insurance company. It is the regular mammogram charge, and then it's the tomo charge. And that goes whether it's a screening mammogram or a diagnostic mammogram. There's going to be 2 procedure codes on that claim. The tomo charge is just the 3D rendering of that for you. For Charlotte Radiology, for the company I work for, it is our standard of care. You're not going to come to any Charlotte Radiology owned facilities and not get a tomo. You may go to other radiology companies and just
So
have
it's a bundled code. It's a bundled code procedure.
It's an add-on code. We added on to our mammogram charge. And that, because that is our standard of care, because we understand that the 3D imaging, the 3D rendering of that service, of the image is going to give us, our radiology, the best opportunity to see if there is something wrong. I want to tell you guys, if you can, make sure you understand if your insurance company pays for it or not. Even if your insurance company don't pay for it, get the tomo. Opt in for the tomo if it's not the standard of care for your radiology company, because it's the best way right now with the current technologies. It's the best way to see if anything is in there, particularly and especially if you have dense breast tissue. So remember this word, tomo. Ask your doctor when you go. This place that you're sending me to get this mammogram, do you guys do the tomo? Is the tomo added on to this? Is this going to be a 3? Make sure you ask about that when you are going
And
to get
ask, is it covered under your services? Because if you go somewhere like Shonda's Radiology Center and it's an addendum code and your insurance doesn't pay for it, worst case scenario, you're stuck with that bill. So
right.
Be educated about what your plan offers. So while you're asking for that diagnostic, make sure you realize whether or not that actual testing is covered on your plan and whether or not it's in or out of network for that particular radiology center.
And the best place to ask is to your insurance company and not the provider.
Absolutely.
Ask your insurance company if it is covered. Even if you got to call the provider and ask them, what is the code for the mammogram and the tomo? There's 2 codes. Ask them for the code that they're going to use and call your insurance company with those procedure codes and ask your insurance company how it is covered under your plan. Your insurance company will tell you how they will pay the claim. And of course, this is based on the diagnosis code and all of that. So if you're going for a screening, that's going to be the screening diagnosis. If you're going because they suspected something on a previous mammogram, then you're going to have, or if you have dense breast tissue, then that's going to be something, there's going to, all of this are variables. There's so many variables that can make a difference in how your insurance company pays it. But ask the question to your insurance company to get the answer. They're the ones who are going to be able to tell you how that code is going to pay out. Okay.
And respectfully, now you said a lot, and that's good. Definitely, because I'm from the insurance side of things, and you're from the provider side of things. I service the providers, but I'm from the payer, so I'm from where you would get your insurance paid. So here's the thing about that. She's absolutely right about reaching out to your health insurance to find out whether it's covered. But in the same breath and at the same time, your doctor should be doing insurance verification before you even present to them. So they should know whether the services that they're getting ready to bill you for and do the services, whether or not it's covered under your plan. So you got two areas of protection. You can call and check for yourself. In the event you don't, your provider that is rendering the services should have already got insurance verification prior to the services to even know whether it's covered for you or not.
Right. But ultimately, the insurance company pays the claim. And so even if we submit something, depending on what the diagnosis code is, it may or may not get covered. So I admonish people to always check with your insurance company first. You can get the codes from your provider, but check with your insurance company since they're the one. And again, Rashonda and I are from two different aspects of it. I'm from the provider side. She's from the insurance side of things. Providers don't pay claims. Insurance companies do. So
right, and that's true. That is very true. However, I want people to understand the protocol of the workflow of a provider, because I think, and I'm speaking from the insurance space, yes, we want members, and we're not even in the same state, so we don't, we may or may not have the same members. I'm just generally speaking right now. Traditionally, if you see a provider, whether it's a radiology center, whether it's an oncologist, whether it's a cardiologist, no matter what specialty you're going to, if you drop the ball as a member and as a patient, your doctor, no matter what their specialty is, should be doing pre-insurance verification, because they do know what they're going to bill. So yes, we are the payer, and yes, we pay the claims, but we don't know what the diagnosis code is going to be. And if the member just calls us with the CPT codes, you know, which is the service codes for what the services that are going to be rendered, we may not know the diagnosis codes. So if, from the provider perspective, if you are advising the members to call and check these codes, please provide the diagnosis codes as well, because it won't be as helpful if they don't have all of the meat and potatoes.
Right, right. And the both of us are speaking in general. You guys,
in general,
yes. So you guys need to be doing the legwork. Do not leave it. For me, when I talk to patients, I want patients to advocate for themselves. Do not leave it in the hands of a provider. Do not even leave it in the hands of an insurance company. You are paying a premium, whether it's every month or every time you get paid. You need to understand how your insurance works. And
absolutely.
And you need to be looking at your EOBs when they come in the mail, or when you go get the notifications in your email that says, hey, you know, such and such has processed your claim, whatever your insurance, Aetna's processed your claim, whoever it is processed your, look at it and make sure that it's been processed according to your plan summary description, right? Or even your plan medical policy, because I specifically have had to call my insurance company and say, hey, y'all told us that if we go to a standalone facility, we would have no copay. And call the insurance company, oh yeah, you know what, you're right. You guys do have that carve out in your insurance plan. If I had not read my EOB, if I had not read that in my plan summary description, knowing that I would not be subject to a copay, then I would have just paid that copay and went on about my business, and they processed the claim wrong. So if you get nothing from both Rashonda and I talking tonight, from the provider standpoint, from the insurance standpoint, you are a consumer. You're paying for a service. Know what you're paying for. Don't leave it in nobody's hand. Do it for yourself. Help the provider out. Help your insurance company out. You know, and I'm gonna just leave that like that.
I will say this, because we're just talking in general, because I don't even really like to talk too much about who I work for. I'm just talking in general. what I will say is this, just like Shonda said, know your plan for yourself and
Read
be
it.
educated on that, and know whether or not the provider, if you have a preferred provider that you're trying to go see, make sure they're in your provider network.
Yes. Yes.
So yeah.
Yes. All of that. There's so many things.
Yes.
What else I want to say about it? Oh, so what else? We were talking about do's and don'ts. I had some things here. If my mouse is going to act right, hold on. And we're going to get off here shortly. I know I told you guys we weren't going to be on here long. Um, let's see. Oh, I just wanted to mention two resources. We talked about the American Cancer Society is one. And for those of you who want to support family members, people you don't know, whoever, you can donate to the American Cancer Society. They are a 501c3 company. I can never say that right. So you can donate, and your donations are tax deductible. Also, the Susan G. Komen Foundation is another one that you can donate to if you don't have the financial ability to support. Do some of the things that Rashonda was talking about. Just by even calling and checking on your family members, your friends, your neighbor, whoever it is, providing a meal, if they want it, going picking up groceries, helping them commute to and fro, appointments and things like that. Make sure you're doing that. What else you got, Rashonda?
Um, Relay for Life. You can participate in Relay for Life as well. You can go to cancer.org. I think it's cancercare.org. And that's the bulk of it. Get connected with some support groups, volunteer,
Yeah.
in any way you see fit. And also, just one other thing, depending on your stage of cancer, you may be entitled to disability benefits. Yes.
That's a good one.
And breast cancer does qualify for disability benefits, by the way.
Okay. Yep. And yeah, I think I'm going to leave it there because I was going to
Yeah.
say some other things. So thank y'all for tuning in. I appreciate everybody for always getting on. This information is definitely ones that we want to circulate in our communities, especially. Women are largely affected by breast cancer, but like Rashonda said, it is not as exclusive to women. There are men that definitely have been affected and been diagnosed with breast cancer. October is Breast Cancer Month, but even if it's not October, there are people that are constantly being diagnosed with breast cancer, and we want to be able to provide a support, whether that's financial, mental, spiritual, physical support, all of those things. So make sure you're doing whatever you can, donating to the American Cancer Society, Susan G. Komen, participating in walks, and different things like that. If you have a family member or a friend or a neighbor or whoever that has been, affected by that, let them lead, but also, provide support, because there are people out there that, like Rashonda was saying, may not know how to ask, may just be a little bit too prideful to ask, but just, um, definitely, keep your ears up, your to the and ears to the ground when it comes to people, because they, um, just imagine if it was your loved one, if it was your grandma, if it was your mom, if it was your sister, your brother, your cousin, whoever it was that is affected, how would you, handle it? There are a lot of people in this world who are by themselves, especially some of our older population of people. They are by themselves. They've lost loved ones, they've lost spouses, and so they may be going through a horrific situation, and just you coming and supplying, someone for them to talk to, could be all the difference in the world. And just keep in mind that if you find yourself in a situation where you are affected directly by breast cancer, there are support groups out there. It's all in your mindset. Keep a positive mindset. Be around people that want you to survive. Keep fighting. Keep fighting. If I say nothing else, keep fighting. If you need help with any of these things, Rashonda is a 10-year breast cancer survivor as of November 1st. We're going to claim it right now. She's
Thank you, Lord.
she's gonna do a walk this weekend out in the Orlando area. If you're in the Orlando area, come out and support. Um, uh, and she's going to be doing some things here shortly that's going to be nationally known. So for sure, make sure you're supporting. When we go live on Tuesdays, I want you guys to make sure you're sending those stars. Share this broadcast, because I promise you, even if it's just one person that hears one thing about what we have said tonight, whether it's live or in the recording, when they listen to the recording, that could affect them in some positive way. That is our aim. Our mission is to have conversations in public coming from a non-clinical space, a non-religious place, even though we both are spiritual people. But to have these sort of taboo conversations out loud and in public in front of people, so that we can, remove some of the stigma and taboo away from these conversations. We were just talking about there are some people who, when they go through sickness, they do not want to talk to people. They do not want to be around people. They're embarrassed because of the hair falling out and things like that. If you're somebody who likes to be done up, if you're a hairstylist, you can provide support by helping someone get a lace front, helping someone get a wig put on.
We've done that one year, actually. Yeah. So yeah, definitely. There's so many ways that people can give back. I'm gonna let you finish, because I want to say one other thing when you're done. I'm sorry.
No, it's right. It's right in alignment. Whatever it is, I'm telling you, there are some people who, I follow these people on TikTok, and they just be talking about, let me tell y'all something. I can do all the things, get dressed up, but when I get my nails done, and they be doing all the things, making the sounds with their nails and stuff, even if you just take somebody to get their nails done, that can make all the difference, because some of us feel real cute when we get our nails done, right? Some of us feel real cute when we get our hair done, right? So
yes.
whatever it is, provide support to these people who have gone through something that, when we hear that C word, it's just something that does something I can imagine to your mindset. But go ahead. I'm gonna let you finish.
Absolutely. No. Take your time. I basically just wanted to remind everyone that if you know a survivor, I think I tagged LaQuisha in here. I know she's a survivor. Congratulations to you on ringing that bell. And if anyone, thank you, Mati. If any of you know any breast cancer survivors that would like to be in a community of like-minded women fighting this vicious dis-ease that we consider cancer, I would love to connect with you. I'm looking to do some very good things in the upcoming year in this space with survivors. I need the survivors that are not afraid to share their story. I need the survivors that don't mind getting up and traveling with me, because I plan on being on the go in 2023, creating opportunity and space for us, not making one time out the year a talk about cancer for us, keeping it very much so relevant, in your face, direct and upfront is my plan for 2023. I got a lot of great things in store. Those that may want to be a part of what I have going on, connect with me, and I can share with you more. You don't have to be a survivor for that to happen. I do need a team. So I'm encouraging those that is interested in getting into this arena and being a part of the support group. I need all hands on deck. Connect with me.
Absolutely. And if I might add, not only the breast cancer survivors themselves, but the caregivers. You know, let's leave room and space for the caregivers of those people as well, because those
Absolutely.
people need support as well. I can only imagine the things that they have to endure, the things that they have to watch, the mindset that they must have to be able to work with, be there for, and support breast cancer survivors and any survivors of cancer or any disease. So,
I'm so glad you said that, Shonda, because I was working on my curriculum for the support group last night. And there is a session, there's a day set aside in the evening for the survivors to come and group session with the caregivers. And it gives gives the survivors a sense of support. It gives the caregivers a sense of understanding so that they can know how to respond for the needs and the cares of the survivor. So I'm so glad you said that. Absolutely. Ditto.
yeah. Yeah. All right. So, again, Rashonda's got some stuff going on. Make sure you guys are following the both of us, but make sure you're definitely following Rashonda Mack. Um, if you're someone who's listening in and you're one of my friends or one of my followers, make sure you are following her as well. If you are someone who's on this live because you follow her, make sure you follow me, request me as a friend so that you get to see anytime the both of us go live. As a reminder, we go live every Tuesday and Thursday at 7 p.m. Eastern Standard Time. We started this off in September. In September, we were talking about personal relationships, and we moved that into family dynamics. And then this week, we've been sort of, focused on different things in the community. And all of this is, community related. Next month in November, we're going to move into a different space or a different topic sector or a different category of topics. It's still going to be, relationship. All of this is,
Relevant.
relationship relevant. Thank you for saying that. But we're gonna get into some different things. Make sure you're following us at any of our day ones, any of our ambassadors. If you're on, make sure you continue to share this live even after this. And also, I want to bring light to, because we were talking on Tuesday about Rashonda's law related to corporal punishment. So I definitely want to just add a little piece on here, because that live got a little tricky. I don't know if it's even still available. So make sure, if you didn't do it on Tuesday, make sure you definitely post something related to the Rashonda's law. We want to get the statute of limitation removed, and we want to talk more about people who have survived or had issues or incidences related to corporal punishment. So this week, we were talking about corporal punishment. We're talking about breast cancer awareness, but this is more community things related. So post something about Rashonda's law, hashtag Rashonda's law, hashtag conversations with the Shondas, hashtag the Shondas, and share this information. And thank you for those of you who have already done so. I see you, Erica. That's one of our day ones. I see you.
Thank you, Erica. Thank you,
Saying,
Miss Terry, Miss Lexine.
yeah. Thank y'all so much. That's it for tonight. We will see you on Tuesday. And any last words? I'm gonna leave it to you as a 10-year breast cancer survivor and thriver.
All praises to the Most High. That's the first thing I want to say. Without him, none of this would be possible. Those of you that know the words of prayer, keep me lifted. Keep me in your righteous prayers. I'm entering a season of my life that I'm uncomfortable, truly uncomfortable. And I guess change is not supposed to be comfortable, but it's a little scary right along through here. So y'all just keep me lifted. I don't know what God got in store.
Good. He more and better and good. Yes. more and better and good things. Okay.
Yes.
All right, y'all. So we're gonna end it there. Thank y'all so much. Make sure you like and share the broadcast after we get off of here. We appreciate y'all so much. You have no idea.
Thank you.
And make sure you're following the both of us. Make sure you're friends with the both of us so that you can see every time we go live, every time we do something. And remember what I said to you, that we're not going to have this content always on Facebook. So if you're keeping connected, then you will be aware anytime this content is moved from Facebook to another platform. I want to make sure that you guys understand that. And tonight, this has been Conversations with the Shondas. I'm LaShonda.
And I'm Rashonda.
And we will see you guys on Tuesday.
Good night.
Good night.